Your zip code, where you live, can have a profound effect on many life determinants, jobs, education, health, and so forth.
What your zip code is a determinant of the access that you're going to have.
I mean, despite all the advancements in things like transportation and communication, where you live is still a very strong predictor of how far you're going to go in terms of both building wealth and staying healthy.
For me, as a social scientist, it makes total sense to me that we've known for a very long time that the environments around us actually shape a good deal of our experiences. And the benefit, I think, of having this conversation about zip code is that it's a trigger device sort of mentally to force us to think about those environments around us.
What you're really asking is, why does the quality of the resources in a neighborhood matter? And there are many reasons for that. Let's take one that I've spent a lot of time talking about, and that's educational outcomes. If you have a neighborhood, which is poorly resourced, for example, which has lots of pollution because it's near industrial sites, has diesel trucks driving through it, has dilapidated buildings and vermin in the environment and empty lots kicking up dust. If you have all those conditions in the neighborhood in which you live, children are going to perform more poorly in school. Children who live in neighborhoods like that, and they're particularly African American children living in low-income neighborhoods, have asthma at 4 times the rate of middle-class children. 4 times the rate. They have asthma because of all those conditions I just mentioned: pollution, diesel trucks, dilapidated buildings, and so forth. And if a child has asthma, that child is more likely than other children to come to school drowsy the next day because they've been up at night wheezing. So if you have 2 groups of children who are identical in every respect, same racial breakdown, same social and economic background, same family structure, but one group lives in a neighborhood where they have a higher rate of asthma, that group is going to do more poorly in school.
You know, in this country, a lot of our schools are funded via property taxes. So neighborhoods, zip codes that are higher income, the homes are more expensive, and so the property tax funds generated are greater. Therefore, their schools have access to a larger amount of money. Whereas in a low to moderate income neighborhood, the homes aren't as expensive and therefore don't generate as much property taxes. So those schools are under-resourced. Well, if a child, comes from a school that lacked the resources, then they're starting life already behind.
I'm aware of 2 school systems where they red light, green light, and yellow light students when they enter kindergarten, pre-K. They haven't been given a crayon by a school system, and yet they are labeled based on zip code, a red light student, which means no potential, a yellow light student, we might be able to teach them something, and a green light student, they should be prepared and ready to learn.
We know that African Americans have shorter life expectancies, greater rates of cardiovascular disease because they live in less well-resourced neighborhoods. The absence of grocery stores that sell fresh food. The absence of medical facilities, primary care physicians who don't practice in those neighborhoods. That contributes to it as well.
And in one key zip code, 10452, here are some stats. 34% of the population smokes. Over 50% are obese. 42% suffer with high blood pressure. Kids in elementary school through middle school are at a 35% attainment level. The high school graduation rate is below 60%. Within a 1.5-mile stretch that covers 4 train subway stops, there are 3 McDonald's, a Burger King, a Wendy's, a Domino's, and a Little Caesars.
Your zip code is a better determinant of your health than your DNA or your genetic code. And I think we've seen that as we look at how this health pandemic has impacted folks more who live in certain neighborhoods than others.
So what's interesting more and more as researchers are looking at the impact of zip code, what we're seeing in many of our cities, almost 50 of the top 500 cities across the country, we're seeing variances in life expectancy up to 20 years. So when you start to map that out, what we know is that place matters, the physical place, the resources, the supports matter of communities. And so it really makes us think hard about how we're addressing health and well-being, but also as a community, how we're making investments in things like preschool, ensuring that all kids have access to high quality preschool, that we have a healthy housing stock, that we're addressing issues like lead poisoning that often occurs in the housing stock of our communities.
When you see a neighborhood which is consistently the site of disinvestment, in other words, where banks won't lend money, where businesses can't operate, then you're also going to find a confluence of other negative effects in those areas, including shorter lifespans, greater likelihood of suffering from chronic disease, a higher level of social vulnerability, which is a CDC measurement of the vulnerability of the population to things like disease outbreaks, such as COVID-19. So all of these factors we're finding are interrelated.
I know of people who have actually died. Just think of it in this pandemic because of where you live, which is the result of discriminatory housing patterns. There are people who are now no longer with us.
But transportation is another aspect of the disadvantage that many low-income, segregated neighborhoods have. Typically, young men of any age really, and women, don't have access to good jobs from those neighborhoods because there's no transportation available. We don't create the kind of public transportation that's necessary. We invest a lot of money in highways to bring suburban, white, middle-class families into urban areas so that they can go to the theater or get to white-collar jobs. But we don't invest in the kind of public transportation that would bring residents of segregated, low-income neighborhoods to good jobs.
If we know that people have dreams about going to college or other trade schools and they can't get to it, that's a barrier. If we know that folks want to work in certain industries and there's no public transit to get them there from their zip code, from their community, we're creating barriers. And so I think it's really about the opportunities that are limited because we haven't taken the time to build up zip codes and communities in the way that they best serve those that live there.
There's a lot of cities in this country that public transportation is not necessarily regional. So therefore, and a lot of the jobs would be, across into the next county or something like that, still close, but there's no public transportation that goes there. And so if you can't get to the job, then, how are you going to be able to work there?
Perhaps one of the most powerful policies that the federal government imposed in order to create the segregation that we know today, the concentration of African Americans in lower income neighborhoods, was a policy that the Federal Housing Administration and Veterans Administration followed after World War II. In those years, they had an explicit racial program to move all white working class, lower middle class families out of urban areas into single family homes in all white suburbs. The Federal Housing Administration and Veterans Administration even required the developers of the suburbs that ring every city in this country today to place a clause in the deed of every home prohibiting resale to African Americans or rental to African Americans. And those clauses in the deed still exist today. Well, those homes that was built in the mid 20th century after World War II for returning war veterans primarily, but for all working class white families, were inexpensive. They cost $8,000, $9,000 a piece. In today's money, that's about $100,000. Those homes no longer cost $100,000 today. As you know, they cost, depending on the region of the country, $300,000, $400,000, $500,000, in some places $1 million and more. The result is that today, African American incomes on average are about 60% of white incomes. You'd think that if people have similar incomes, they'd have similar wealth. But in fact, while African American household incomes on average are about 60% of white incomes, African American wealth is about 5% of white wealth. And that enormous disparity between a 60% income ratio and a 5% wealth ratio is entirely attributable to unconstitutional federal housing policies that were practiced in the mid-20th century and that have never been remedied.
One of the most significant means of building wealth in our country is home ownership. And yet, where you live, your zip code can in fact have both a positive and a negative effect on your ability to build wealth through home ownership. If we could get higher rates of home ownership in those neighborhoods, there's a greater chance that African Americans and other minorities can build the type of wealth that the rest of America, particularly white America, builds.
75% of white families in the US own a home. Just 49% of black families do so. Money you put into your house eventually turns into equity that you can withdraw in a variety of ways. A lot of that money winds up getting passed on to your children, either in the form of education or investment in housing for them.
For folks that aren't coming into generational wealth, that aren't being left that type of wealth, not being able to purchase a home in a place that will gain value is the ultimate deterioration of somebody's wealth. And so when we think about the practice of redlining, every community has value, every community has worth. And if we invest it and allow potential homeowners to invest it in the right way, their wealth will raise, the property values will raise. It really is this wave of community impact that can happen. And so it really is the most detrimental way that financially we're keeping people down and unsuccessful.
You can go back a couple of decades and look at a map of Cleveland or a map of Washington where I am right now, or a map of damn near anywhere, and you can see redlining, and you can go back decades before that to Jim Crow, and decades before that to black codes, and decades before that to slavery. I mean, you can see how this is all connected that way.
You cannot ignore slavery and have this discussion. Slavery is, and the downstream consequences of our failure to address the state of slavery continue to echo today.
I am of African descent, right? I mean, if you trace my lineage, I'm somewhere from Western Africa. They grabbed us from there and brought us over on the ship, and here we are in the Caribbean and in the United States. If you go back to some of those communities where I'm from, genetically, they ain't suffering from high blood pressure and obesity and some of the things that we are suffering with here. Genetically, we have the same makeup, but that's not what has led us here. What has led us here is in communities that have been redlined after slavery was abolished, Jim Crow, the Civil Rights Act, all of this stuff has happened. We are still in segregated ghettos in America. And what happens in those neighborhoods is that resources are scarce to non-existent, investment is scarce to non-existent, opportunities for getting out are scarce to non-existent, and we have a problem.
And redlining, where banks literally in those days would draw a red line around areas they weren't going to loan to, you can still see it driving down the street.
If you live in a neighborhood that was redlined in the 1930s, that means that a pattern was established at the time where banks refused to lend money for housing. The downstream consequences of that are that the housing itself is in worse shape. It's worth less money, it's typically in worse repair, and it's hard to borrow money against it even.
In predominantly minority neighborhoods, home values are typically lower. That is a consequence of historical racial discrimination, both from government policies and from private real estate discrimination, racial steering, and racial redlining by financial institutions.
People have pointed out the fact that we are segregated and have tried to do several things to correct that. But what's happened? Most recently, a year and a half ago, in a zip code that governs the Upper West Side of Manhattan, this is where people who probably make upwards of 150 to millions of dollars a year were being asked to accept into their super high functioning schools 25% of the kids of a neighboring zip code. So this is now above 96th Street. So now you're talking about West Harlem, and where kids are not as affluent and we're not doing as well on standardized tests. To accept some of these kids into their prime middle school as a way for a better integration, which is proven to help. And there was a major uproar amongst the residents of the Upper West Side. And this includes people who are brown, black, affluent, white, the mix. And that tells us something. So what opportunity zones offer is a way to push in to some of these pre-existing systems in a way that could be beneficial to everybody, especially for kids who are, who are people who have been marginalized.
I think it's really hard to pinpoint the exact place where discrimination is happening, but when we look at things like unemployment data or disparity indexes that tell us how diverse communities are, it's very clear that we still have a lot of work to do. And I think part of our opportunity is to really think about how do we invest in things that people are telling us that they need and want, putting them in places where they tell us they want to be, and making sure that they can be successful while they're there. And so eventually we'll start to see those disparity indexes close, and we'll start to see unemployment go down, and we'll start to see financial stability and net worth rise. And I think that's how we'll really know that discrimination is on its way out, and that we're really doing a good job of turning the tide in that space.
I am a fourth generation college educated Black woman. They exist, right? I thought everybody's life was like that. Home ownership is an expectation. It's not something in my affluent Black neighborhood. Everybody owns a home. That's nothing new. Everybody has an expectation you're going to go to college and you're going to do something with your life. That's not new. When we sought to live in a zip code that matched the financial gains, we were denied that opportunity at first. But my mother and father were the first Black family in the white neighborhood. The discrimination we felt was incredible until we moved in. When you lived in the neighborhood, you had an automatic membership to the country club that was a part of the community. When they found out we were moving in, they voted to make it private.
Well, I'm not suggesting to you that the police would never discriminate against African Americans if so many low-income Black families weren't concentrated in single, poorly resourced neighborhoods. But it's much, much worse because of that. When you concentrate the most disadvantaged young men in single neighborhoods without access to good jobs or transportation to get to them, or schools with high achievement, or any of the other conditions I've just described, the police assume the stance of an occupying force and develop policies and practices, stop and frisk, for example, which would never be tolerated in a middle-class neighborhood.
So I don't think policing ever sets out to be inequitable or unequal at its core. But I think what we find is that whether it's implicit bias, whether it's lack of communication, whether it's lack of trust building, it really goes to impact on how police and community interact. And when those relationships aren't strong, we get instances where it seems like populations of people are being targeted or communities are being targeted, or police feel that they're not making any traction. And I think we really have to think about how we better bridge that communication gap to say, you know, we're here to keep you safe. We want to be safe. How do we work together to really create the safest communities that we can and help those relationships grow? And I think we'll start to see some of that implicit bias, some of that perceived discrimination start to go away.
So certainly in today's environment, it requires us to take a very hard look in the mirror about systemic and institutional racism. How both within healthcare, we know that there's significant racism that's happening both inside our four walls, but also as communities, and how we're making investments in things like housing, how we're supporting individuals around education, how we're funding education, both at the federal, the state, and the local level.
When you ask ordinary folks, you and I, right, what are the things that you want to see in your community that help you be healthy? Like we can take them off really quickly. We can go like, yep. And then when you ask people, like, does that exist in your community? It actually takes people a moment to sort of go, wait, I think we have other, right? So we're not actively kind of in the conversation and in the thought process of like, does my community represent ideally like what it means to have a thriving place? And if so, great. How do I contribute to make sure those things are sustained? And if not, how do I get those things in my community, right?
Zip code is a construction of the post office. It's the efficient way in which they deliver mail. It really doesn't have anything to do with the inequality that we have between the races in this country. It's a nice gimmick to try to tell people that where you live matters, but I would prefer to say not your zip code matters, but your neighborhood matters, because that's what we're really talking about. Some zip codes might be all affluent, some zip codes might be all low income, and some span the two. So zip codes themselves are not a useful way to think of the differences and the inequality that we have in Toledo or anywhere else.
Historical patterns have not changed. The redlining, the impact of redlining, the impact this federal government has had and continues to have in segregating our communities and perpetuating segregation.
It's as if they've crumpled up that wonderful paper that is your life, and they've thrown it down on the ground and stomped on it because they didn't think that you were good enough. And even though you took that paper up and you straightened it out, the creases are still in there. That blot is still in there. For some people who experience housing discrimination, it is like that.
Kind of the understanding that it's not just about investment, it's not just about redlining, it's about all of these other factors such as public health and education and policing, and that they all relate to these same core issues, which are, when you have a pattern of disinvestment that creates these racially concentrated areas of poverty, then those become kind of these nexus points for all of these other negative impacts.
There are very few legislative efforts being worked on to heal past inequality. We have a Fair Housing Act that we passed in 1968 that prohibits ongoing discrimination. But because of the conditions I described before, the wealth gap, for example, it doesn't do any good to prohibit ongoing discrimination if we've created a situation where African American segregated families don't have the wealth to be able to be discriminated against. They can't move to highly resourced neighborhoods in the first place.
We know that we have to meet immediate basic social needs. If someone is struggling with housing or food, we need to connect them to the right resources and supports. But we also need to take a longer term approach and really drive structural changes to change policy, systems, and environmental change. And so it's really, again, those immediate basic needs, but also making sure we're using our voice to have a longer term view and driving some of the larger issues across communities as well.
What I'm excited about in this current moment, quite frankly, is the opportunity to undo that. If we made those systems, right, we can remake them in a way that actually makes it so that, like, what does it take to make all of us, to make those systems like really balance that out so that we all have an opportunity to succeed? What does that look like? So when you ask this question about what does it tell us about communities that are thriving, that are well-resourced, and those that are not, I say, we know how to do it, right? There's a blueprint right there. Let's get busy. This is an issue of will, of public and political will, not an issue of the knowledge to do what we need to do.
How do we invest in the community around us? So we saw a lot of dilapidated housing in this community, and so we wanted to make that investment with our partners. We know that if folks are able to and interested in working at the hospital, this is a walkable neighborhood to a major employer, so we invested in job training. We're investing in financial stability and really saying, how do we take one core neighborhood and invest and layer and leverage resources in a way that we're fulfilling the vision that the community has created.
We worked on, in my community back in Illinois, was housing and recreation, because housing is so central to everything. So whatever we can do to correct the inequities that we see in housing, the discrimination that we see in housing, is, for me, the first step.
Neighborhoods, zip codes are not invested in equally or with equity. So when we see disparities in housing or people being able to access commercial or retail services, food, social services in an imbalanced way, that is really how zip codes have the ability to be impacted and really have negative impacts on people's health, their social determinants, and their stability.
So we have got to take the stigma off of these zip codes. We have got to invest in communities in a way that is reparative, in a way that provides for equity, not equality.